Boils are painful, pus-filled bumps that develop when hair follicles become infected, often by bacteria like Staphylococcus aureus. These infections can start as small, red, tender lumps and quickly grow larger, filling with pus and becoming increasingly uncomfortable. Boils can appear anywhere on the body but are most common on areas that experience friction, such as the neck, face, thighs, armpits, and buttocks. While they may seem minor at first, boils can sometimes become serious if not treated properly. For small boils, applying a warm compress several times a day can help speed up the healing process by increasing blood flow and encouraging the boil to drain naturally. However, if a boil is particularly large, extremely painful, or located on sensitive areas like the face, it's important to seek medical attention. Boils in these locations can lead to complications, including the risk of spreading infection to deeper tissues or even the bloodstream. Attempting to squeeze, pop, or drain a large boil at home is not only risky, but can actually make things worse. This can push bacteria deeper into the skin, increase inflammation, and lead to more severe infections. In some cases, bacteria from a boil can enter the bloodstream, causing a serious condition called sepsis. Additionally, improper handling can result in permanent scarring or the formation of new abscesses nearby. You should see a doctor if the boil is larger than a golf ball located on your face, neck, or spine, or if you notice symptoms like fever, chills, or swollen lymph nodes. These signs may indicate that the infection is spreading or becoming more severe. Medical professionals can assess the situation and determine if antibiotics or a minor surgical procedure are needed. People with underlying health conditions, such as diabetes, weakened immune systems, or chronic illnesses, should be especially cautious. These individuals are at higher risk for complications from skin infections and should seek prompt medical care at the first sign of a boil or abscess. A healthcare professional can safely drain the boil using sterile techniques, reducing the risk of further infection and minimizing pain. They can also provide guidance on proper wound care, prescribe antibiotics if necessary, and monitor your recovery to ensure there are no complications. Trusting a medical professional not only brings immediate relief, but also helps ensure long-term healing and prevents future problems. Don't hesitate to reach out to your healthcare provider if you're unsure. Your health and peace of mind are worth it. The doctor begins by examining the boil to assess its size and severity. The area is cleaned thoroughly with antiseptic to create a sterile field. The incision site is marked with precision, often following natural skin lines to reduce scarring. Tools like a scalpel, forceps, and sterile gauze are prepared. The doctor and staff wear sterile gloves, and a drape exposes only the surgical area. This meticulous setup prevents infection and ensures a safe procedure. Every step is designed for patient safety and optimal healing. To keep the procedure painless, the doctor injects local anesthetic, usually lidocaine, around the boil, not into it. Injecting into healthy skin avoids the acidic abscess environment, which can neutralize the anesthetic. This ring block numbs the area, preventing pain during the incision. The doctor waits a few minutes, then tests the area to ensure numbness. This careful approach prioritizes patient comfort and safety. Effective anesthesia allows for a smooth, controlled procedure. The goal: drain the infection with minimal distress. Once numb, the doctor makes a precise incision over the most fluctuant part of the boil, following skin tension lines to minimize scarring. Thick pus drains out, providing immediate relief. Gentle pressure helps express remaining pus, taking care not to damage healthy tissue. The doctor may use a sterile tool to break up any hidden pockets of infection. Complete drainage is crucial to prevent recurrence. This thorough technique ensures the abscess is fully emptied. The process is quick, but every step is deliberate. Proper drainage sets the stage for healing. After draining, the doctor uses sterile gauze to remove any remaining pus. The cavity is flushed with sterile saline to wash out bacteria and debris. This irrigation may be repeated until the fluid runs clear. For large boils, this step is done carefully to keep the area clean. Sometimes, a sample of pus is sent to the lab to identify bacteria and guide antibiotic choice. Thorough flushing reduces the risk of recurrence. Cleanliness here is key to successful healing. For deep boils, the doctor carefully packs the wound with a sterile gauze strip. This technique is crucial to keep the wound open and allow continued drainage, which helps prevent the formation of abscesses and promotes faster healing. The gauze acts as a wick, drawing out any remaining pus or fluid from the wound site. The packing is intentionally left loose, with a small tail left out of the wound. This tail is crucial as it allows for easy removal during follow-up visits. The loose packing ensures that the wound remains open, facilitating continuous drainage and reducing the risk of infection. After packing, a sterile dressing is applied over the wound. This dressing serves multiple purposes. It protects the wound from external contaminants, absorbs any drainage, and provides a barrier against bacteria. The sterile environment is essential for the wound to heal properly. The dressing is then securely fastened with medical tape. This step is important to ensure that the dressing stays in place, keeping the wound clean and protected. Properly securing the dressing also helps to prevent any accidental dislodgement, which could expose the wound to potential infections. Before leaving the clinic, patients receive detailed instructions on how to care for their wound at home. This includes guidance on how to change the dressings, the importance of keeping the area dry, and signs to watch for that might indicate an infection. Proper home care is essential for the healing process. Continued drainage from the wound is normal and expected. Patients are advised to change the dressing if it becomes wet or soiled. Keeping the wound dry and clean is crucial to prevent infection and promote healing. Proper wound care at home is vital for the healing process. Patients should follow the instructions provided by their healthcare provider meticulously. This includes cleaning the wound, changing the dressings regularly, and monitoring for any signs of complications. The dressing acts as a shield, protecting the wound as the body works to repair itself. Over time, with proper care, the wound will heal and the skin will regenerate. The goal is to ensure that the wound heals without complications, leading to a full recovery. Healing continues at home with careful wound care. It's essential to follow the instructions provided by your healthcare provider to ensure proper healing and avoid complications. This includes cleaning the wound gently and thoroughly, using the recommended solutions or antiseptics. Change dressings as instructed, keeping the area clean and dry. Make sure to wash your hands before and after changing the dressing to prevent infection. If you notice any unusual discharge or odor, contact your healthcare provider immediately. A follow-up visit is scheduled within 1-2 days to remove packing and check healing. This appointment is crucial to ensure that the wound is healing properly and to address any concerns you might have. Mark your calendar and set reminders to avoid missing this important checkup. Antibiotics may be prescribed if the infection was severe or if you have risk factors. It's important to take the full course of antibiotics, as directed, even if you start feeling better before finishing them. This helps to completely eliminate the infection and prevent resistance. Watch for signs of complications, worsening pain, redness, swelling or fever, and contact your doctor if they occur. Early detection of these symptoms can prevent more serious issues and ensure timely intervention. With proper care, the wound heals from the inside out, usually leaving only a faint scar. The healing process can take several weeks, so be patient and follow your care plan diligently. Immediate pain relief is common after drainage. This relief can significantly improve your quality of life and allow you to return to your daily activities more comfortably. Professional care and diligent follow-up ensure the best outcome. Regular communication with your healthcare provider and adherence to their recommendations are key to a smooth recovery.